Hi, my name is Christina, and I'm currently the office manager for Dr. McIntyre, but today I want to tell you why I began working with him. As a teenager, I was in a terrible car accident where the car rolled 6 to 7 times. Through that accident, I incurred a severe neck trauma. I lost rotation in my neck, I couldn't look over my right shoulder, and over time I developed severe migraines. After working with Dr. McIntyre, I can now say that I have been migraine-free for over a year and a half. I'm one of those people that after the first adjustment, I felt the migraine I had that day dissolve over a 2 to 3 hour time period. And through yoga and through upper cervical care, I have regained optimum health. And now I just believe it's an important message to get out to people that you can also be healthy, pain-free, without medication.
Okay. When I saw the advertisement on this upper cervical adjustment, I really didn't know what it was, so I came to see the film. And the night that I was here, I had been going through a lot of problems. I had had 5 bladder infections in a row. The antibiotic that they were giving me was giving me terrible pains in my legs and actually making it kind of hard for me to walk. And I thought, if this will help me, then it'll be worth it, because I was getting worse while I was going to the doctors. And I was also having nausea every day, bad in the mornings, and dizzy. I was having trouble walking across the room without doing a little side step. And my daughter told me that the smoothies were making me sick every morning, but that was the only thing I could keep on my stomach in the morning. So anyway, after I had been in the treatment for, I don't remember now, 2 or 3 or 4 weeks maybe, I was talking to my sister on the phone, and she says, well, is it helping you? And I said, I don't know. And she said, well, are you still nauseated? And I said, you know what, I'm not. I hadn't even thought about it. And so it was such a gradual thing with me that I have to stop now and think back where I was and where I am now, and I'm a lot better. Since I started the treatments, I have not had another bladder infection, and I was having them one right behind the other. And I don't have to take the antibiotics anymore, and I hope I never have to take another antibiotic.
Your body was designed to work a certain way. Your brainstem is what regulates what happens in the rest of the body. It acts like a tower in a cell network, routing the information between the brain and the organs, muscles, and tissues. Unfortunately, the brainstem rests in a delicate area where the head and the neck meet. It comes out of an opening at the skull's base and drops down into the ring of the top bone in the neck, making the alignment between the skull and the top vertebra very important. If that alignment is lost, then the brainstem becomes irritated. You can no longer normally regulate all the functions of the body. Abnormal function leads to internal breakdown and the development of abnormal conditions.
When I first met Dr. Chad, it was at the Health Expo in Greensboro, and at the time I was looking for a chiropractor in general, but when he began to speak about the actual treatment of upper cervical care, I became instantly curious. I have never believed that I should require ongoing, constant adjustments, even though I have done that in the past. And so when I heard about upper cervical care and how it is more of the monitoring of the atlas bone than the bone cracking and the physical adjustment of the entire spine, I became very curious. And I went ahead and I took the chance and went under Dr. Chad's care. And the first night was a very, it was kind of an intense evening. He had warned me to not schedule anything, and it's definitely nothing physical, and so I chose to watch a movie. And as I watched the movie, I could feel the changes in my body. I did not feel pain. I can't say that I was out of pain, mostly because I didn't realize I was in pain even when I began the treatments. As I went through the process of my ongoing treatments and the adjustments when they were needed, I did find that, oh wow, I had been in pain. I had reached a point where my tolerance to the pain was so high that I just ignored it. And so as I continued through the treatment, the beginnings of the treatment process, my back realigned. I started to have natural curves, which are normal. Previous to that, my back would literally be flat. I could feel my spine on the floor or on the bed when I laid down. And even today, I now have a natural lower back curve, which continues to excite me just because that's the way it's meant to be. Shortly after those little changes, I began to notice that my legs were the same length. I was able to stand, and when I stood, I felt like I was standing on both of my feet instead of just a little bit off center. When I was in my 20s, I was diagnosed with a mild case of scoliosis, as well as being told that one of my legs was longer than the other due to a pelvic tilt. As I went through and my body began to naturally adjust from the atlas bone being in the correct position, suddenly I didn't have the hip pops and the hip cracks that I had before. The pain that was associated with that went away.
It was New Year's 2009 when my youngest daughter, 10 months old, started having seizures. It seemed like she was having seizures every 2 months at the end of the month. We sought help by going to specialists, and we had all kinds of tests done, and everything came back normal. We didn't know what else to do. We just kept watching her. It was very sporadic, so we really couldn't put her on any medication, and I always try to do things alternative anyway, so just wasn't getting any answers. And it was the summer of 2010. So that following summer, a friend had mentioned about Dr. Chad McIntyre, so we came and saw him. He was very considerate and helpful. He was caring about my needs with my daughter and making sure that she was comfortable, and he assured me that the procedure was very gentle, which it was. So she was adjusted, and it's now 2011, and she hasn't had a seizure since. She might struggle in the middle of the night, at the end of the month, but she does not have a seizure. She's healthy. We don't worry about her anymore, and that's my story.
When the brainstem is irritated, the surrounding muscles and tissues become inflamed. We use thermography to discover that inflammation precisely and in a pattern specific to each person. We also use a series of postural analyses to assess if a person's body has structurally compensated. If necessary, we'll then take precision x-rays to identify misalignment down to the nearest millimeter. From there, the correction of the misalignment is gentle and safe and involves no pulling, cracking, twisting, or popping. It requires very little force, so our youngest patient is 6 months and the oldest is 91 years.
I'm an aerospace engineer, and I've worked on space projects for about half of my career. And so I was really impressed with the technology I saw with what Dr. McIntyre does with the thermal imaging. I could see right away that it was quick, efficient, and very accurate. And then the computer program he had to analyze both sides to see how it was doing and the stored images. I thought, wow, this is really fantastic. And then one of the most important things he said is that if he didn't, the software would tell him if he needed to adjust or not. And if adjustment wasn't needed, he didn't do it. That's extremely important. If things are going well, you don't want to change it. So I was really impressed with the technology and how easy it was used, and it just made a lot of sense.
Immediately after I get adjusted, I can feel the adjustment and the change in my body immediately. I can feel pressure release from the nerves in my neck. As I take deep breaths, I can feel blood circulate down all parts of my body. I wiggle my fingers, my toes a little bit, and I can feel that fresh circulation to parts of my body and my spine, my back, my neck, where it feels like it's never been before. I immediately, as I'm laying down, I can feel my shoulders drop, tension release in my back. I can feel muscles in my back start to engage and work around the adjustment that they never have been before, and it's a very engaging feeling. My muscles feel energetic, my tendons, my ligaments, everything feels connective.
I was involved in a couple of car accidents when I was younger. The first one was when I was 9 years old, and about 4 years after that, I developed into some pretty significant lower back issues. They actually diagnosed me with a slipped disc at age 13, which is pretty much unheard of. And I got better for a little while, but by the time I was 17, when I got in my second car accident, it didn't take quite as long for my body to start breaking down after that one. I developed pretty quickly after that, about a year later, into chronic upper back, neck, and shoulder issues. And I had that for a long time. I was in pain all day, every day, from pretty much age 19 to age 23. And I went to a lot of different types of doctors. Medicine really didn't work for me. Physical therapy really didn't make a dent in what I had going on. General chiropractic really was the one thing that helped me get to a certain point where I could at least manage my pain level, but I was still in pain all the time. When I was 23 years old, I was introduced to upper cervical care, and it just made a lot of sense to me. It was probably the one thing that I had kind of been introduced to throughout my years of having so many issues that actually did make sense. You know, I had shoulder and lower back and neck and issues, along with digestive problems and a mild case of ADHD, and all anyone ever wanted to do was just kind of treat my symptoms. And here comes this thing called upper cervical care that actually talks about getting down to the root cause of problems, and that actually made sense. So I got under care, and 3 weeks after the first correction I had, I'd felt the best I'd felt in really over 10 years, and I just continued to get better and better to the point where I decided that's what I wanted to do with the rest of my life. It actually got me energized and enthused about actually being a doctor. So it literally has changed my life. After I got under care, I mean, 8 months later, I meet my wife. Just my life in general changed. My attitude changed. I was able to better focus. My digestive issues settled down, and my chronic issues with pain that I figured I would have for the rest of my life went away. Most approaches to being healthy revolve around symptom treatment, but what that ignores is that symptoms and conditions have causes that often come from the body simply not working the way it's designed to. There's too many people that are suffering and too many people that will suffer because they don't know about upper cervical care. If you're sick and tired of being sick and tired, then change your life through upper cervical and get your head on straight.